a manicuring service, it's very important that we know how to properly disinfect and protect ourselves as well as our guests during the service. One of the main federal agencies charged with the enforcement of safety and health legislation is OSHA, or Occupational Safety and Health Administration. Within salons, we're also required to have MSDS sheets. These are compiled by the manufacturers to let us in salons know any product safety, hazardous ingredients, and also how to properly handle these implements to reduce the risk of accidental harm or exposure. Within salons, EPA is a registration number or labeling we must have in order to use these products. This is an example of an MSDS sheet. Decontamination. You have sanitation, which is removing visible dirt and debris, disinfection, which controls microorganisms on non-porous surfaces. Sterilization destroys all microbial life, including bacterial spores. In a salon, we're required to use disinfectants that are bactericidal, virucidal, and fungicidal. There's 3 ways to clean tools or implements. Wash them with soap and water, ultrasonic unit, or a cleaning solvent. In order to fully decontaminate, there's 2 steps. First is the cleaning, and second is the disinfecting. While we're cleaning, we must remove all visible dirt and debris, wash them with warm water and soap, and scrub with a brush to get all the grooves and crevices. Second, you must disinfect. Disinfection is going to eliminate most microorganisms, but it's not effective against bacterial spores. Disinfectant must have an EPA registered label, and it must be used according to manufacturer's directions. How to use disinfectants properly is very important. You always want to use these on pre-cleaned surfaces. Make sure when using disinfectants you always dilute per manufacturer's directions. Make sure you follow directions for contact time, how to spray, and if immersion is required. Only use as directed, and it must be an EPA registered disinfectant. This is a common disinfectant called barbicide in the proper container. Because we're using chemicals like disinfectants, it's important that we remember safety. Always wear gloves and glasses for safety. Add the disinfectant to water. Use tongs, gloves, or a draining basket, and always keep away from children. Don't ever expose to your hands. Always wash and dry thoroughly. Carefully weigh and measure the products. Any container containing disinfectant must be marked. Follow the directions, and your solution must be changed daily to prevent contamination. So how do we know when to disinfect or dispose of an item? Multi-use items like nippers, shears, combs, and pushers can be properly disinfected and then used again. Single-use items like orange wood sticks, cotton balls, and tissues are one-time use and must be thrown away in the proper receptacle. Also note, absorbent nail files must be thrown out if it breaks the client's skin or make contact due to the possibility of spreading disease. The proper procedures for disinfection require you to pre-clean, rinse, and dry them, making sure that you don't contaminate your disinfectant. Your implements must be completely immersed in the disinfectant. Remove them with tongs, basket, or gloves. You need to rinse, air dry them, and then store them properly. Here's an example of how you should clean and fully immerse your implements. So make sure when you're handling disposables, you wash your hands with antibacterial soap or hand sanitizer. So what happens if you or a guest gets cut? We have some universal precautions that we follow. Anytime blood is exposed, you need to stop and clean your area. Put gloves on in order not to contaminate anything else. Apply antiseptic to your wound. Bandage it, clean your workstation, discard any contaminated objects. You must disinfect tools, and then remove your gloves and wash your hands before restarting. We handle all blood as infected blood. If you're not properly disinfecting your implements or preparing your natural nail correctly, nail fungus is a real concern. Any moisture trapped under the nail or even a localized infection in 1 or 2 fingers is possible. These infections can be spread to other nails and clients if your implements aren't disinfected before and after each client. Here are some examples of nail funguses. As a cosmetologist, it's your professional responsibility to protect your client's health as well as your own. Don't ever take shortcuts when it comes to disinfection and sanitation. To be an effective cosmetologist, you must learn and follow all the rules to the letter of the law. By doing so, your peers and clients will maintain a sense of trust and respect for each other.